Sanbonani, and welcome back to another episode of Living with HIV by Usihle Wakamlobeli. We all know that we currently have no cure for HIV, but being a part of a community that is both informed as well as supportive might just be all that we need. But oftentimes, we find that most of our patients feel very overwhelmed and very anxious before a counseling session, which is very understandable, and their feelings are very valid. But at the same time, I found that providing the information during the consenting as well as the counseling session, there is too much information overload, which is why we are now trying to find ways to provide the information, right? It's not that you are not allowed to ask again on your next counseling session, but you find that some people are still scared and still finding themselves and still trying to navigate and understand what it really means when we say they're HIV positive. So in a sense, they are now not able to ask their health professionals or practitioners in terms of what it means or what are we saying when we're saying that they're HIV positive. So to eradicate some of the anxiety, to eradicate some of the fear, let's use the internet. Let's use what we have on our hands, which is social media, which is our cell phones, which is our technology, which is the internet as well, to try and educate each other so that we are well informed. And we all know when we don't know something, it's either we ask the next person that we are familiar with or we feel most comfortable to, or we go to the internet. So why not use the internet to provide education and background on HIV and AIDS, as well as use the internet to create a support structure, in a sense, a support group for those living with HIV, in a sense, a group or a community. I think I like that word more. A community where we can come together, learn from each other. So in times we do actually find that with the feelings of being overwhelmed, with the feelings of anxiety, a lot of information is missed, which actually defeats the purpose of providing health education, as well as providing the psychosocial support to our patients, because there's a lot of information going on. There's a lot of exchange of new vocabulary to some people, new words, of which that on its own is overwhelming. The feeling on its own is overwhelming. And just imagine, like, take this in, sit back and think it through, think things through. You've just been told, or you've just been diagnosed. You've tested, right? And now you've been diagnosed with HIV. What would your thought process be? I know this is different for everyone, but what would your thought process be? Or initially, if anything that is shocking happens in your life, or you are given news that you were not expecting, what is your initial reaction? So that is what I'm trying to say, in a sense that some people do not adjust or are not able to take in all the information that we are trying to provide. So using this platform today to try and start that journey of the support, to start that journey of educating and being there for each other is very important. I know some of us, we are scared of our health professionals. There's a lot of stories that you hear when you actually sit down and get to talk to patients and get to know them. you know, hey, khansela lenu, kwat. So we need, oh, dokotela wenu, kwat. So we need to open these channels so that we all have information from the right channels, the actual channels in which we should be learning about health related or reproductive and sexual education from. Right. So I thought to myself, what could be topics that are most fitting for our very first conversation or for our very first sit down together as a community that is living with HIV, right? So some of the questions that I'm usually acquainted with on the very first session, and I thought that could be a very crucial starting point for the channel, and a very crucial point in ensuring that our patient understands what it is that is truly going on. So let's get right into it. What is HIV? HIV. Some still frown on just hearing the name. Some are scared. Some there's anxiety. What is HIV? Let's define that. Thereafter, we'll move on to defining AIDS, because HIV and AIDS go hand in hand. We cannot separate the two. Both these words are acronyms, right? Let's just try and break them down into simpler terms and just explaining it in simpler words, basically. So the H is for human, I is for immunodeficiency, the V is for virus. So for H, it's the human, immunodeficiency, V is for virus, right? So humans, it means the virus is transmitted between humans. Immunodeficiency, what it is, or what do we mean by that? Immunodeficiency, it means the virus weakens the immune system, of which your immune system is an organ or organs that are responsible for fighting off any form of bacteria, infection, diseases, or virus in your body, right? And then the V is for virus. So it's the virus that causes diseases in your body. So the V is for the virus that causes disease in your body. So essentially, it is the virus that affects the body's immune system. So that's what HIV is. So let us move on to AIDS. Right? So if HIV is not treated, basically it now graduates to being AIDS. So for most people, it just ends by being HIV. But if it's not treated, of which most of those cases happened a while back, because most people were not taking their treatment well due to reasons that we'll discuss in due time. The ARVs have been effective and have been successful in suppressing the virus, which is what we want on anyone who's diagnosed with HIV, to suppress the virus to less than 50 copies. So moving forward, we'll be able to break that down in what we mean by viral load, in what we mean by CD4 count, because the two go hand in hand, and we do test for the viral load and we do test for the CD4 count at least once a year if that person's virus is suppressed, but we do it every 3 months if that person or individual's viral load is not suppressed. So it's important to understand what we mean by viral load. It's important to understand what we mean by a CD4 count, but I'll look into that at maybe in our next vlog, and actually breaking that down and explaining why we take the CD4 count and why we take the viral load, because those two bloods are very important on someone who's been diagnosed with HIV. Just remember, we're learning one step at a time. I am not by any means trying to overwhelm anyone. Kancane kancane sizobamba nje. Siloke sithatha, sibamba, so that we are able to understand and try and lessen, that burden of being overwhelmed or being anxious by receiving an overload of information all at once. So yeah, a part of this process and a part of this journey, we'll be breaking things down as we go so that we are all in the same page, right? So stay with me. So moving on to AIDS. Né? So AIDS is the acquired immune deficiency syndrome. So it's the acquired immune deficiency syndrome. AIDS, acquired immune deficiency syndrome, right? So it's acquired because it is transmitted from one person to another. It's acquired because it's transmitted from one person to another, right? It's an immune deficiency because it weakens the immune system, right? And reduces the body's ability to be able to fight off any form of germs or disease or infection, And then it's a syndrome because it's a collection of symptoms that make up a disease, right? So that's AIDS. It's acquired immune deficiency syndrome, AIDS. So we'll keep it at that. We'll cap it at that. And yeah, keep it simple. And now, moving right along, let's focus on the how, which is my favorite part because we get a lot of this. How? Kwenzakaleni? Kwenzeke ntoni? Do you get? How? How is it spread? How is HIV spread? How did I get infected? How is HIV transmitted? How did I get infected with HIV? How? Right? And this question usually comes up exactly at that point where someone has just been told they're HIV positive. The how. And a lot of us are fixated on that question and we put our focus and all our energy towards the how. And which for some people, it sometimes usually leads to anger. Because maybe, just maybe, you're putting things together in your mind now and you're drawing the picture and you're seeing what might have happened. Let's take this moment and listen carefully, because for some people, they fully understand how it is that HIV is spread, how it's transmitted, how you can get infected, whichever way you want to put it. But for some people, there's stereotypes as well that are sometimes involved, and myths that are not true in terms of how HIV is spread. The how HIV is spread. So let's go into that and let's try and break that down for you. So HIV, right, is spread through three. Nothing more, nothing less. It is spread through 3 bodily fluids. HIV is spread through 3 bodily fluids, right? The first one is blood. The second one is sexual fluids, and that we include semen and vaginal fluids. And then the third one is through breast milk, right? So HIV is spread or transmitted through 3 bodily fluids. That's your blood, which is being the first one. The second one being sexual fluids. The third one being breast milk. Now, let's break that down and explain. So HIV is spread through one of the following ways. HIV is spread through having unprotected sex, right? Or unsafe sex, unsafe sexual intercourse, right? What do we mean by unsafe? It means that there is no protection. Having sex without using any form of protection, it's having sex, it's unsafe because there's no glove, there's no condom. So it's having sex with someone who's infected with the virus, and that person happens to be virally unsuppressed, which means their viral load is more than 50 copies, of which that means it's now easy for that person to transmit the virus and infect the next person. That your partner is virally unsuppressed, meaning the viral load is more than 50 copies, which makes it easier for the virus to infect the next person during unsafe sex. It may also happen that your partner does not know that they're infected with the virus, which is why it's important to encourage each other and to encourage our partners as well to go out there and test for HIV, so that we are all aware of our status, to lessen or reduce the possibilities of onward transmission, or to reduce the possibilities of infecting someone else. So HIV is also spread during transplant of tissues like your organs. It also happens in that sense. With healthcare workers as well, they used to be infected while trying to assist or while trying to help a patient back in the past, but that's a thing of a past. PEP was introduced and it's been working wonders, which is your post-exposure prophylaxis, but we'll get into that at another vlog. HIV can also be spread through sharing of sharp equipment such as razors, for your shavers, for your scarification. Some may know it as ukpaza or uchaza, that some people usually perform for traditional affiliations. So with that being said, we also train our traditional healers to be aware of HIV and how it is spread. So we do find that there's been immense improvement in terms of seeing our traditional healers or hearing from our patients that they are using, one razor per patient, of which kudos for doing that. But if you're still out there and not changing razors between your clients, please, siyacela, do better. And for some people, it's okay, just carry your own razor, right? Siyabantu ekugcineni, and we do need to do what we need to do. So if you feel ukuthi you need a razor for whatever it is that you're about to do within your journey, ensure that the razor is safe, meaning it's been used on you and you only. And last but not least, HIV can be spread mother to child transmission, right? During pregnancy, we have a 10% risk of the mother infecting the baby. During labor and delivery, we have a 60% chance of mom infecting baby if mom is HIV positive. And then during breastfeeding, we have a 30% chance of mom infecting baby. So we always keep tabs with our pregnant mommies. Mommies, do not worry. As long as you are going to an antenatal clinic, we do make sure, and we try by all means to ensure that you and your baby are taken care of, in keeping tabs or keeping in check with mom's viral load if mom is HIV positive, but in also keep testing our pregnant mommies that are HIV negative, to ensure that should mommy test HIV positive while pregnant, then mommy is able to be initiated and introduced to the treatment at the very same time to ensure and decrease the chances of baby being infected. Let me just try and speak to our fathers as well. Words of encouragement. Let's take this journey. Ubasi babini, we both want this child to be delivered very healthy and HIV negative, which means that during the pregnancy, the father as well go out, take the necessary steps and get tested for HIV as often as possible, because we're all aware of the window period, to ensure that mommy and baby are fine. So it's a two-way thing. Umama no baba, to ensure ingane izozalwa i-HIV negative. If dad is HIV positive and dad is currently on treatment, let's ensure that dad's viral load as well is suppressed. If dad's viral load is not suppressed, let us have protected sex, meaning let us use a condom to try and ensure that the baby is born negative, which goes the same way for moms as well. If mom's viral load is unsuppressed, let us use what? A condom to ensure that our viral load decreases, because we've heard of cases where someone is virally suppressed and then when they're pregnant, their viral load changes. When the viral load changes, it's very important in terms of protecting the baby for mommy to start using a condom, as well as for mom and the healthcare professionals to see in terms of the treatment that mom is taking, is it working effectively if mom is adhering to the treatment. Our third question would be, why is it important to test for HIV? And we get this question a lot, especially with our males. When we go out, we do campaigns, we go out, we do drive-bys, and you try and invite people. They ask, why is it important to get tested? I'm not judging, but it's very important, guys, to get tested. Because if you know of your status and you are currently testing HIV negative, that now helps you to make informed decisions in terms of trying to prevent or trying to maintain your status as HIV negative. So looking into what kind of contraceptives, looking into what options are available for you in order to stay HIV negative. The same can be said for someone who's testing HIV or tested HIV positive or diagnosed already as being HIV positive, in the sense that the importance of testing is now able to help you make informed decisions in trying to ensure that you are now reducing the chances of infecting another person, right? And in finding ways and in finding the correct information from your healthcare professionals in terms of what can you do, right? Of which we have discussed that, and discussing with your healthcare professionals to see what it is that works for you, and being able now to make informed decisions, right? That there's no other way of finding out that you are HIV positive. I know people have this thing of looking at someone and assuming, no, you're wrong. That is not the way. We need to get tested so that we are able to know what our status really is. And going out there and testing, you are now able to know your status, not only for the next person in trying to prevent them from getting infected, but also for yourself, because introduced to care, and that essentially means you're being educated, you're being counseled about HIV, you are then initiated to HIV treatment, meaning you are started on the treatment for ARVs. The earlier you start, the better it is, or the more chances basically you are giving yourself for survival. Providing us a chance at life is providing us an opportunity to continue living, an opportunity to tick off that bucket list, an opportunity to see your dreams come into full fruition, right? Which is why we always say it's not the end. You are given another clean slate at going about life and living life, right? As long as you are taking your treatment. It is very important to take your treatment. Moving right along, our next segment or discussion will be on HIV prevention. How do we prevent HIV? How do we prevent the spread of HIV? Let me put it like that. So this includes abstinence, right? Abstinence from sex, right? This includes being faithful to one partner, right? I start with these two because there's a whole lot of conversation around that. Some feel it's doable, some feel that it's not. And you know what? I understand. I understand both parties. And I know some of y'all are asking yourselves, how kanjani manje? Kanjani manje? No, I completely understand those that feel that it's not doable. And I like the fact that they're being honest with the healthcare professional that's sitting on the other side of the table so that we can be able to advise them further. I like open conversations like that. It's being comfortable enough to speak up and say, nah, that's not doable. No, I can't. Which is what we are trying to achieve. But there's many ways to skin a cat, right? We try the next thing. It's just that simple, right? So if abstinence is not your thing, if being faithful to one partner is not your thing, let's try condom use, right? The correct usage of condoms, ne? The correct and continuous use of condoms. I keep saying that because you find that you go to your nearest healthcare facility, you take your condoms, or at times you find us saying, I'll find a condom, would you, be interested in having condoms, and then the person takes them. Some don't really use them. Buenzela, that healthcare worker, which is not how it should be, right? Omunye, yes, they do take them. Well and good. They do use them. Kudos. But the challenge now starts with the correct usage, right? And the continuous usage. But let's cap that and leave that for Friday. That's what I'll be speaking on this coming Friday. So if you want to know more about the continuous and correct use of condom, tune in. I'll see you guys on Friday so that this vlog is not too long. Then we move on to PrEP and PEP. These two go hand in hand, right? The other one is PrEP, PrEP, right? Pre-exposure prophylaxis. Pre, it's in the name. Ngaphambi kokuthi kwenzeke. Ukuzivikela. It's a prevention method before unsafe sex to prevent yourself from being infected. So it's pre-exposure. Ukuzivikela ngaphambi kokuba uye ocansini. Right? So in this sense, you are planning prior, right? You're not deciding today, which, you know what? I'm just going to have unprotected sex. It's planning prior and using a preventative method to try and stop you from being infected. if you happen to have sex with someone who's infected. So it's planning before. The same as the condom, you plan before, right? And let's move away from that instance where we're moving all over the house trying to find a condom. No. Let's plan before, right? But we'll speak on those things on Friday. And then we have the post-exposure prophylaxis, which is post-sokwenzekile, right? The other one was ngaphambi kokuthi kwenzeke, which is your PrEP. The post-exposure sokwenzekile, right? We find incidents where someone has been exposed to unsafe sex. It could be via rape, right? We don't choose that, right? It could be a case whereby someone at work who's a healthcare professional is exposed to a needle, right? It could be at home. Something happened and you know that you're exposed to blood, you know. It's always important now to go and get yourself checked out and then be initiated into the treatment, or be given the treatment to start taking the treatment, right? Because there, it's post-exposure. We are now trying to prevent you from being infected with the virus. With post-exposure, it's now happened, which means let us try and get to a health care facility within 72 hours, right, of the incident, or 72 hours of having been part of unsafe sex, right? 72 hours. Now, to someone that might seem like a lot of time, but for someone who might have went through a difficult time, but I'd like to appeal to someone who's been through that experience, maybe you've been raped, to try and move towards a healthcare facility. There's a multidisciplinary team. You'll receive counseling, you'll see the nurses, you'll be given the PEP, which is the post-exposure. Let us try and take izinto one step at a time and try find help. Yeah. And then with PrEP. Well, PrEP we take once a day. We take it once a day for a duration in which you feel that you are at risk, because you are trying to prevent yourself, because you're trying to prevent yourself from being infected. And then with PEP, it's a cycle of 28 days where you take pills. As soon as the 28-day period is done, you're done, because it's post-exposure. But even there, we often come through and screening is done. Statistics include males that have sex with males, MSM, our transgender individuals, we have orphans, we have vulnerable children, we have our adolescents, especially women that are between the age 15 to around about 24. We have our sex workers within this category, and we also have our inmates in correctional services. Research has shown that we have key population when it comes to new diagnosis and statistics for new HIV infections. Before forgetting, people who inject drugs are also part of the key populations. So PrEP is there, guys, as a pre-exposure prophylaxis. And should you feel that you would like to hear more of this, you can easily go to your healthcare facilities, but I'll also be discussing more of this. But you obviously need to go to your healthcare facilities or centers, as well as the fact that it's not only about the people that have been mentioned under this key population. Should you feel that you are at risk of being infected with HIV, just go consult your nurses, your doctors will have more information to give you upon this preventative drug that is there, that is PrEP. And there's an eligibility criteria that we usually look into before we give individuals PrEP. So which is why it's important to go there to consult, so that we can see whether if you're eligible or you're not eligible to have PrEP. But yeah, it's there, it's available to you guys. And yeah, let's practice safe sex. Let's use our preventative methods, whether we are HIV positive or HIV negative, to prevent the spread of HIV. So last but not least, we'll be discussing some of the symptoms for HIV infection. So when someone is diagnosed or someone comes in and is presenting of symptoms for HIV infection, these symptoms are then put into a category of 4 stages. So we then take the symptom and then we look into which criteria or which stage does this particular patient fall under. Stage 1. Most people don't present with symptoms, right? Some present with flu-like symptoms. Some present with persistent enlargement of glands. Okay. During stage 2, we start to see a pattern of symptoms, right? These include skill-related symptoms or conditions, a yellow flaky rash, we see ibanti, shingles, herpes, we see nail fungi, we see a lot of weight loss. Stage 2. To stage 2, your symptoms start showing themselves. Basically, the virus now starts, showing you within the body, uthi ngikhona, I'm present, take notice of me. During this period, we see a lot of skin conditions. It could be a flaky yellowish rash. It could be a bumpy itchy rash. It could be a fungal nail infection for some people. Libanti okanye ibanti, your herpes, your shingles, that's what stage 2 basically is inclusive of. Yeah, it differs per person. We all know symptoms, guys. We can also include weight loss for stage 2. So basically, it's your body beginning to show you, okay, take notice. It's your weight, it's your skin conditions. Do something about it. Go ahead, get tested. But don't wait, guys. Just familiarize yourself with getting tested, and just know, we'll see every 3 months I'm getting tested. So that you're always aware of your HIV status instead of waiting for symptoms, right? We're moving right along to stage 3, right? With stage 3, we usually witness pulmonary TB, which is TB of the lungs. We witness about 10% weight loss per month. So yeah, your body basically is gradually graduating, and the symptoms are now beginning to really show themselves, so that you can, you know, come and get tested. But let us not wait for the symptoms. And then we have recurrent, you know, diarrhea, ukhishwa isisu, asiphelile isisu. Now awuqonda ukuthi kwenzakalani. Go to your nearest clinic and ungasinikezi iy'nkinga. You know, for some people, umuntu uyamcela ukuthi, okay, I'm seeing A, B, C, and D. Is it okay if siyakutesta? Ala umuntu. Sikusiza kanjani-ke? All right. And then lastly, for stage 3, we also have a consistent oral thrush, meaning it's in the mouth, and it just, yeah, is persistent. Moving along to stage 4. This is when we can officially say that a person is now diagnosed with AIDS. So it's now HIV and AIDS, right? Okay. These are some of the symptoms. It's TB in the parts of the body, either in the lungs. If you remember, in stage 3, it was in the lungs. So in stage 4, it starts to spread to other parts of the body, like the lining of the brain, the spinal cord, your bones, are the parts that come to mind. There's an oral thrush, you know, that is untreatable, that is running on your throat, which makes it difficult to eat. And there's something called HIV wasting. That's when we can't even explain how drastic you are losing weight. You know, it's the weight loss. It's a very fast and drastic pace, if I can put it like that. So in stage 4, basically, it is you now having to come forth, and healthcare professionals now having to come forth, because your CD4 count has dropped so much and your immune system is really compromised and is really feeling the pressure. And so we need to ensure that you're taking your treatment. You also need to ensure that you are taking your treatment. So to prevent ourselves basically from getting to stage 4. Stage 4 also includes cryptococcal meningitis, which is a fungi infection that is covering the brain. Yabo? It's getting complicated. The names are getting complicated. You know, Kaposi's sarcoma, which is our KS, which is the cancer of the skin. So yeah, it's getting complicated now. So just to avoid finding out at such a later stage, I say fundiseni to go out there, get tested, see fundise, to know our status, to speak to our partners about our statuses, and kube into eniyidiscussayo kahle kahle nopartner wakho ukuthi okay, ngihambile ngatesta kuthiwe i-status sami ngi-positive, ngi-negative. Kusho ukuthi-ke manje, this is how we can prevent ourselves based on what your HIV results are. Let's have these conversations with our partners, guys. Open the room. Speak about it. Kungabikho uvalo, you know, when you need to speak to your significant other about your status. Because status sakho also affects your partner as well, you know. Right. So it's important to also take note of the fact that in as much as I've discussed these symptoms as well as the stages for HIV infection, your nurses definitely know these things. They'll discuss these things further with you. But yeah, I think we need to get to a point whereby we understand how serious the situation is and how important it is for us to go out there and get tested, right? So kungathi ukuthi you're hearing me now speaking about a rash of fungi, you seeing a rash and then now you panicked. Just go to your nearest health facility noma umtholampilo wakho oseduzane nawe, and then get tested and let them know ukuthi this is what I'm experiencing and I'd like to get tested. But they usually know what procedure to follow based on symptoms in which a patient is presenting. But yeah, it's important for us to have these conversations so that we all understand what it is that we are actually dealing with, of which it's HIV and AIDS. That was a mouthful. I hope you learned a lesson or two from today's episode. Okay, let us not forget to like, share, and subscribe so that we are able to build this supportive and knowledgeable community around our sexual and reproductive health. Like, share, and subscribe. Living with HIV by Sitlem Lobil. I've once heard that passing knowledge is a gift of love that is given to others to pass down protection. So let's echo that and live by that on this channel. Comment on the comment section so that we can further engage. Ask questions so that we can further engage and take this conversation further and build this community, because that's what this channel is all about. Thank you for tuning in and staying with me this far. I really appreciate it. Let's not forget the lesson from today's vlog. Let us all get tested. Let us all know of our HIV status, right? With that being said, that is all from me to you for today. I'll see you guys on Friday with another interesting episode on condoms. So don't forget to tune in around Friday, 12 midday. Thank you. Goodbye.